Hi, it's Dr. Noel Williams, August 22nd, 2020, Optimal Health Associates. It's our COVID update. I'm a little calmer today because I didn't get the shocks I got yesterday. And so to address some of that stuff, so people's comments are always interesting and wonderful, and it gets to a central topic we're going to talk about today. It's not my job to post every single news story in America. I'm going to tell you what's going on, just like it's not your job to look up every journal article to figure out what's going on. I mean, you can. I try to post the realistic ones, but I said yesterday that the governor had a story broke that showed that the governor had received recommendations from Dr. Birx and had said he didn't receive any and said we were not in a bad spot in Oklahoma. And someone in his staff release that, and I'll post that stuff today. But again, that's not my job. You can look it up on the news. I was on the news. I saw it on the news. Sorry. Likewise, it was also on the news that we're not reporting COVID positives and testing to the state health department any longer because they don't really want the data, or they had a problem with their software system or something. They've forgotten to tell all of us that. So again, that's just on the news. It's not anything I can do about it. And so you look it up. And if you can't find it, you're not good at looking stuff up. I'm sorry. I mean, I don't have any interest in lying. When I get those messages, I just think they're funny. Like, no, I'm going to lie when I have thousands of people watching, and most of the thousands of people watching are people I'm friends with and take care of and know. It's just idiotic to have those thought processes. So let's talk about thought processes. What's the difference between us, humans, and everything else, any other animal? Of course, Kim said, well, opposable thumbs, and it wasn't what I was aiming for, because there has to be someone else with an opposable thumb. I think monkeys or something. But what do we have that no one else has in theory? The ability to reason and to think. And my brother and I were talking about this morning. And no, we can think. So just look at the data and think. Think. Do the challenge. Don't react. Think it through. Think about what you're reading. Think about what you're hearing. Think about it. Don't just think, oh, they've criticized person X or the plan over here. That must mean they hate, and they have this hate for them. No, I have a lack of respect for some people. I don't hate them. I mean, I look at Fauci. I think Fauci seems like he's probably a nice person. It's just something has happened to them. And so one of the things we have to look at with all of this, let's do a timeline so you can be aware of how COVID started again and what happened, because it gets lost in time and people forget stuff and don't know because they weren't paying attention. Because who would have paid attention to COVID in January except people who are a total nerd like me, or in theory people at the CDC. So let's just go backwards, okay? So sometime in December, towards the end of December, the Chinese government said that there was a virus going on in Wuhan that came out of a meat market. Now, we know from our Defense Department that the virus really started in October, maybe even September, because of intercepts. There was a notification of the federal health agencies sometime in late November that's documented with the heads of the different agencies, and there was a top secret meeting. They had two more top secret meetings, and again, they won't release who was there, which makes sense now because they'll look really bad, but we can imagine the cast of characters. So there were two meetings in our country over this in December with the health heads with the Defense Department. By January 3rd, the Defense Department had totally funded a COVID vaccine research effort. Since they already had a SARS-1 research effort for a vaccine, they switched it to SARS-2. It showed up on Trump's daily briefing on the 3rd or the 4th, the day before the impeachment stuff happened or started. So that's just the timeline. With what kind of how it happened, information came here. But remember, the World Health Organization was notified by Taiwan somewhere around late teens or December 20th, 21st, somewhere in there, that there was a new illness coming out of China. It was spread by respiratory droplets. They were very concerned, and the World Health Organization totally blew them off and denied, one, wouldn't respond, ignored the data, and then if you jump forward a month or two, they said we never knew about this and da-da-da-da-da, when they did. And they clearly ignored the data. So we'll move forward from there to January. So in January, there's more and more data coming out of China showing there's a major infection going on in Wuhan. And it's from the meat market, and it could be from bats. And that's why there was all the bat stuff. So then the critical mistake occurred in China for the Chinese New Year, where people travel for Chinese New Year, and so they let 5 million people travel from out of Wuhan towards, the January 15th roughly to about the 25th, where then they cut off the travel. And that is what caused dissemination of the virus across the world to an extent. That was the big ticket moment. We know from France data that their first COVID pneumonia death was in mid-December, and that's well documented and reported in the medical literature and publicly. So it had already left China by November, early December, but it really disseminated in January. And that's why cases started to go up, and that's when health heads, by early February, started saying, oh, there's COVID, or it was SARS then. And early in February, Dr. Robert Redfield was on TV multiple times talking about, oh, we're going to have this infection come here. We're going to be in a mitigation strategy. We've been working on a test, blah, 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 blah. And that's when Fauci really started to get on TV, which is what generated my interest in starting to post, because Fauci said, we're not going to have a pandemic. We have nothing to worry about. He'd already been saying that in January, but then he started going over the top immediately following that weekend around February 6th, going that this isn't happening, this isn't happening, this isn't happening. We don't need to prepare. We don't need to do anything. By mid-February, again, people, if you can't look, and I'll post it again. I'll post this because people have such a hard time understanding that Dr. Fauci screwed this up publicly on purpose so badly. But not because on purpose, because he's a bad human, but he had an agenda. And it was not the agenda to take care of the health of the United States. And he publicly said masks don't matter, as did Jerome Powers. I'm blanking on the name of the Jerome, the head of the Public Health Service. They all said masks didn't matter. It turned out they knew they mattered, which we all knew they mattered, but they were afraid the PPE would run out. Now, keeping in mind that no one at the CDC, NIH, or the FDA ordered any PPE, even though we knew we depleted all of ours previously on the swine flu. And so here they know this pandemic's coming, and Robert Cadillac, the Assistant Secretary of Preparedness at the FDA, did nothing to help us prepare. So by the end of February, we stopped travel from China already. Things are starting to get a little hairy. There's some information about hydroxychloroquine maybe could work. The remdesivir data is starting to be like, what's going on with this? And we're basically in total chaos on a public health level. From there, around, I think it was that first Friday in March, maybe around the 5th or 6th, Trump, announces we're going to shut down Europe. We have a plan. We're going to universal testing. And I think he said Google was going to have something to track, and we were going to be doing all this fabulous stuff because at that point we knew the CDC had screwed this up so epically bad. It will go down in the history of public health as the single worst performance ever, even worse than the World Health Organization, because they didn't ever develop a test, and we still don't have a test that's consistent or works. And Bill Gates, who may have his own agendas too, is completely right about that, and he's been publicly speaking about that this last week. So I'm thinking at this point, just where I was, we're going to shut the country down. And for those of you who have listened to me that long, you poor people, I thought Trump would shut the country down by somewhere between 25,000 and 50,000 cases to give us a break. it looked like that's where he was going to go, but something happened around the 8th, 9th, or 10th, and all of a sudden he reversed from being very conservative, we're going to do this, this, and this, to no, we're just going to leave everything alone. I'm just observing it. It was clearly a mistake to do that. It's not that I'm mad at Trump or I'm an anti-Trumper. It's just it was a mistake. He makes decisions based on information, and you know who I think he's getting the information from, so you know. But that was a mistake. I think we'd all agree. Look where we are now. We have 175,000 dead with no one reporting the accurate numbers, and tens of hundreds of thousands more people with long-term damage. And we're not even to the bad part yet. So that's just what we got to in March. We had our flare then at the end of March, April. That was earlier than expected. We shut things down nicely, not definitively, but pretty well. Things looked good. Things were toning down. May, we started opening things back up, and our 20-somethings, God love them, were really bored and started going to bars a lot, and that really probably was the big impetus of the increase in cases. We also had the tragedy of George Floyd and those protests, and that may have contributed, and a few other things like that. But ultimately, it was socialization, meaning, hey, I want to go and see my friends and have a drink, or go to a bar, or go to a pool, or go to a beach, or go to the lake. So the cases have come back up. And so that's where we are now, where different parts of the country, the South has been much more devastated this round than the North. But we're all going to be back in the same boat in another few months. And that's really how we got here. And we have no, and again, it's just observation for me. There is no cogent plan for the United States from the FDA, the CDC, or NIH. And that is not an executive, judicial, or legislative branch thing. That is them. They should have had a plan for us doctors, nurses, and caregivers and providers. What do we do for patients who are freshly infected with COVID? What do we do? Because there are things to do. It's a big lie that the only thing they should get, remember, is Tylenol. That is the standard only therapy for outpatient. It's Tylenol. So there's more to do than that to help people. And so that's where we've been. We have no direction for care on an outpatient basis. Thankfully, there's some pretty good direction on inpatient care, but the goal, of course, is not to become an inpatient where you can die. And there's very little to no outpatient post-infectious care, which is a big deal since people are having strokes and have all this damage to organs after the infection, even if it's minor. And again, the FDA, CDC, and NIH aren't doing anything to try to get a program in place so that anyone can see. So again, and that's not, again, executive branch stuff. Executive branch stuff's different. Yes, we still don't have a plan from them either, other than just let's have everything open. But I don't know what else to say about it other than it's just where we are. And it's just a bummer. I mean, Dr. Birx was here last week and said, hey, you have a problem in your state, and this is what we need to do. And she met privately with our governor, and the governor then said that, no, we don't have, afterwards said, she didn't give us any recommendations and we don't have a problem. Well, we do have a problem, and that's how it is. But the whole country's going to have a problem in the fall. I will absolutely love to be wrong, and everyone can make fun of me and crucify me and say I'm the worst, dumbest doctor ever. But it sure looks like we're going to have a really tough fall of COVID. We're going to have influenza. We'll have walking pneumonia. And it's not going to suddenly go away after the election. I think I hear a lot of people say that. They think it's all political. I'm not thinking COVID's political. I don't think it really notices what party you're in. And I think when it drops to about 42 degrees, which is the temperature it seems to proliferate the best at, so the fall, late fall, we're going to see a lot more COVID than we're seeing now, and we're seeing a lot. So that's what we have to be ready for. And so again, I'm always going to focus on vitamins, nutrition, masks, social distancing, and I really think all of us need to be prepared for a tough fall. But that's my summary. I think I just wanted to review where we've been in a nutshell, and not overwhelm everyone with details, nor do I want everyone to think that this is all about politics for me. It's not, which those who watch me know, it's just about science and trying to make people not get sick from COVID or die of COVID. I don't want people to die. It's that simple. I don't care if you're a Democrat or a Republican or an independent or nothing. That doesn't matter to me. I don't want you to die of COVID or have a stroke or pulmonary embolism or damage your kidneys or spend 3 months recovering from it if we can help you. That's what my message is. We want to help people not get sick. So that's all. Any questions?
No.
Okay.
I'm gonna let you go.
Have a good Saturday. Bye.